Well, I've been in practice for almost 29 years after residency, so had a number of interesting cases here and there. One that's most recent that I remember, it was actually a family member of one of our office staff, and he works as a welder and a machinist, so he's a pretty heavy-duty guy, and he'd been ill for a week, and of course didn't come in until he was all but passing out and had fever and chills and was extremely weak and dehydrated and was really ill, and had respiratory symptoms, and he was starting to get jaundiced, and he was very ill. So we put him in the hospital. He had a pneumonia, which was somewhat atypical. It had different areas of involvement, not just one local area. And so we put him on our, we usually start with a shotgun approach, or you put on multiple antibiotics to cover pretty much everything until you figure out what it is. You do cultures in the meantime to figure out what it is. Try and culture sputum, culture blood, culture whatever you can to find out what the organism is, and we did that, but that takes a couple days or a day or two. And we also involved infectious disease specialists, which we do now via telemedicine. We use an interactive video setup, and they can interview the patient, and of course some of it is secondhand, they get information, but they assisted and ordered some other tests too. And anyway, what it turned out to be was a case of Legionella, or Legionnaires disease, which we don't see very often at all, and certainly don't in our part of the country. It had, it was originally described as a Legionnaires convention, or Legion convention, where they had contaminated airflow, ductwork, and got it through that type of infection. But we couldn't pin down how this individual got it, but very interesting. But our initial antibiotics got him started getting better, and then we got more focused when we found out what it was, and he recovered uneventfully. So it was a good case.